Sculpting. Let's shift to that now after we looked at Matt James and thought, how could we maybe look a little bit more like Matt James? Because he was super hot. We were talking about what I would look like if I wore what he was wearing. He looked hot. How would I look?
The hat would ruin it for you because you could probably do the shirt, but we all know how you look in hats. You have a couple of gifts. You can wear any sort of sunglasses and look just hot like fire.
Like flames.
Just, yes.
You put me in
on
any
a hat,
hat.
Dopey McDoperson.
In absolute dum-dum.
It's okay.
So with that, as we move in the right direction, CoolSculpting, I said my sister Janie's been asking a lot about this recently. It's a treatment that you've probably heard of at some point. It actually freezes fat cells and can really help tighten up some of those stubborn areas of body fat.
But you probably didn't know that there's one clinic in Minnesota where they know CoolSculpting better than anyone because they were instrumental in actually developing the treatment. So I had to get the full story from the great team at Zel Skin and Laser specialists, including how kids with popsicles sparked this whole idea.
Okay, Dr. Zelickson, it's so nice to get to talk to you. And we're talking about CoolSculpting today. And I'm so interested in your perspective on CoolSculpting because people might be familiar with it. They might not be familiar with your connection to the development of this.
It started probably 12 or 13 years ago. There were some studies showing that when kids were eating popsicles, they froze the inside of their cheek with the popsicle. And after the skin healed and everything, they noticed that there was a dimple in the cheek. And when they looked into that, they saw that the problem was that some of the fat cells were gone. There's a fat pad that we have in our cheeks, and that was gone. So they proposed that the fat cells were more sensitive to cold than other cells.
What do you want people to know before they come in to get CoolSculpting done?
When you're coming in, first we're going to see you for an evaluation. And you're going to meet with us one-on-one where we can really address what your concerns are, what your problem areas may be. But we'll also do a global assessment to make suggestions on how we think it would be best to proceed to get you to your goals.
Generally, what the device does is it kind of sucks up an area of skin and fat, like your love handle or something, and it creates a little vacuum to suck it into a cup, and then it cools it down to a certain temperature for a certain amount of time. People got more comfortable with it, and people started doing more applications. So instead of just doing kind of one on each love handle, we would do 4 or 6 or 8 around the area.
Yeah.
And then you really started to see a pretty significant difference.
And how are you handling things with COVID-19?
You know, in all actuality, I really feel like CoolSculpting is one of the lower risk procedures that we're doing here in office in terms of COVID. But we're following strict protocols here with our COVID-19 personal protective equipment. We're all wearing N95 masks, and we get you going, we get you set up on the machine, and then you're actually kind of hanging out alone for about 30 to 45 minutes while the CoolSculpting machine is doing its thing.
Listen, for a lot of people who are working from home and spending a lot of time with their families, being in a room by themselves for 30 to 45 minutes, I think that might be the treatment in and of itself. Like the CoolSculpting, the results are just the bonus to that experience. Yes. As we've advanced, what kind of results are people seeing?
So many changes have occurred, and part of it was, number one, starting to treat larger areas. So we have larger applicators that we can treat larger areas, and even smaller areas. So we have smaller ones that we can address sort of fat deposits underneath the chin, the submental fat deposits.
Well, and then it certainly makes people, when they're thinking, hey, where should I go for CoolSculpting? Like, I'd like to go to the place where they were instrumental in the very beginning of it, because you've got an expertise and a connection to it that, not a lot of people have.
I was on the medical advisory board of the company for many years. We did the clinical studies with them. There's always some amount of risk to it, even though with this one there's little, but you do enough of it, you're going to see some complications and you're going to have some issues. And so we've seen everything that can go wrong. So we know how to handle it. And I think if I'm looking to have a procedure done or something, I want to look for somebody that does a lot of these procedures and that has the ability, if there is a complication or problem, to be able to take care of that.
How many sessions do you recommend that people come in for? And then what kind of results are we seeing?
The textbook answer is we expect to see about a 20 to 25% reduction in the treated area after one treatment. But for most patients, the general rule would be, I think it really takes at least 2 treatments before the patient starts to see the results. So, and again, each time we treat an area, you're getting, 20 to 25% reduction off of what you already had. So the results compound on themselves over time.
Well, this has to be really rewarding for you to be able to to do these types of treatments and just have people get to their goals and feel really great.
Yeah, it's exciting. We're always happy to be able to help patients become, their best selves. And this is kind of a fun, unique treatment that we offer.
Come on. You see the pictures, and they're hitting target zones like that.
Yeah.
And then right down there in the love handle region, lower abdomen, that always feels like even if you're losing fat or in good shape, you just look down and say, why are you guys still
I know.
here?
It's such a cool concept. And I think that idea that it came from realizing that there were like little dimples in kids' cheeks when they would eat popsicles was how they realized, hey, when you freeze these cells,
There's like a
something's going on here. It's really interesting. So Zel Skin and Laser Specialist is offering an exclusive deal for TCLers. You can buy 3 CoolSculpting cycles and you'll get the 4th one free. You can call the clinic or book your appointment online. Just let them know that you saw the deal on Twin Cities Live, and we've got all that info on the website too. So if you didn't get that exact web address,
put it up there.
Right there.